Good afternoon, everybody. So we are about to head into the second half of the day with the Massachusetts versus Lindsay Clancy trial. And the thing that I think stuck out to me the most, because it just opens up the doors for so many realities that people have faced in healthcare, came from Susan Clancy, Patrick's mom, who, like many other people, said how wonderful of a mom Lindsay really was. Her words, quote unquote, she was begging for help. Begging for help. And it makes me think, how many people who are living with a disability have had to beg for help? I can guarantee that most of us who are in that situation, whether for a physical or mental ailment, have had to beg for help. And why should it come to that? I think that our medical, mental health, and physical health systems need to start paying more attention to when patients are begging for help. Not just assume that we're drug seeking, not just assume that maybe we're overreacting. I definitely see that more with women, unfortunately, where doctors seem to think that women are overreacting. This could have been avoided, is what it comes down to. All of this could have been avoided if somebody just listened to Lindsay. Think about back a few days ago, I think it was late last week, how much Lindsay was messaging one of her providers on my chart, begging for a phone call that she never got. Just my chart messages and encouragement. Dr. Tufts' encouragement. What is that encouragement actually doing when this woman is suffering? And you know what? This goes way beyond just mental health, okay? People with physical ailments who are suffering from chronic pain frequently just get ignored for years upon years upon years. I can say that as a woman with Ehlers-Danlos syndrome. So I think we need to start holding the bigger systems accountable. We need to start holding the doctors who don't listen or aren't hearing our complaints. They need to be held accountable. This woman asked for help. And I see people saying, imprison her for life. She's already in a prison. She's never going to be able to walk again. I don't even want to think about the horrors of how she has to shower or use the bathroom or anything like that. This woman's life has already been taken from her. And these 3 kids have lost their lives. And these grandparents have lost their children. And many other people, they were a loved family in the community. They have lost a member of their community. So I just encourage all of us to start advocating more that doctors listen to us. And when they don't, filing those grievances, reaching out to patient advocates in the hospital and doctor systems, doing whatever we have to do, because all of us deserve to be heard. If we're reaching out for help, there's likely a reason. Are there people that are drug seeking out there? Absolutely. But I think the numbers are much lower than we'd like to think. So, and then you have Lindsay. She didn't even want to take this medication. She was scared about this medication. She was afraid of becoming addicted to it because of the horrible stigma attached to medication. There's a lot of work to be done, folks. And it's really sad that these are the circumstances that had to bring that to light. Let's listen in on the second half.